Students waste their valuable time in the clinical exam by asking a ton of closed-ended questions. My strategy in the OST or in my real life as a clinician is to ask open-ended questions. Let the patient talk. All I do is I'm just thinking about my next question. Instead of asking a patient, where is the pain? Is the pain moving anywhere? How bad is it on a scale of 1 to 10? Is it sharp? Is it dull? Instead of that, tell the patient that you would like to know more about the pain and let the patient talk. When the patient is talking, all you do is you actually listen to what they're saying and you think about your algorithms to rule out the rest of the questions. This way, you have good control on the history taking, and also you can literally steal the patient's script. In the clinical exam, the patient is given a script. He can't go outside of the script. So when you ask open-ended questions like, tell me about the day, what else, anything else, and if there is any positive finding, for example, if the patient says, Doctor, I have fever, just ask another open-ended questions, tell me about the fever. If they say, Doctor, I have a cough, tell me about the cough. I'm bringing up phlegm when I cough. Tell that you're asking about the phlegm. So this is how you actually ask open-ended questions. Let the patient talk. You sit down, relax, have control on the station.